Remarks.
Got my speech here, Premier Dexter. Thanks, Daryl. Jim Merkley, Dr. Jennifer Lang, and particularly the hardworking staff here at the Waterford Consolidated Hospital, the Hospital Foundation, and my good friends, the Ladies Auxiliary, and invited guests here today. As we all know in this room, the Waterford Consolidated Hospital has been a staple in our community for the past 50 years, providing families with health care they need, and I am proud to say that quality care will continue in this hospital, in this location, for years to come. As the Premier mentioned, Nova Scotians have seen a vast improvement in health care delivery in communities served by collaborative emergency centers. This is what I want to see here in New Waterford as well. And the development of this CEC is about securing the future of this great hospital. We are taking an innovative approach that we will evaluate to make sure that the needs of this community is being met. I also want you to know that the Waterford CEC will be structured a little different than the other CECs across Nova Scotia. The basic principle behind the CEC will remain the same. It will bring together emergency care and local family practitioners working as a team to provide improved health care to our broader community. During the day, the New Waterford CEC will offer better access to primary health care by a team of health professionals, including doctors, nurses, nurse practitioners for extended hours 7 days a week. The CEC will provide same-day or next-day access to appointments as needed. And most importantly, this CEC will also provide 24/7 access to emergency care. In the evenings, emergency care will be provided by a nurse and a paramedic working under the guidance of an online physician. However, unlike in other areas of Nova Scotia, these healthcare professionals will be in a mobile unit and will see patients in their homes. A lot of thought, research, hard work has gone into the development of this particular CEC model, and I believe that a mobile unit is right for this community. What we have discovered in the development of CECs across Nova Scotia is that each community is different, and that healthcare needs of Nova Scotians vary from community to community. Here in the Waterford, we know there are residents who have limited access to transportation and in some cases don't drive. With a mobile CEC, residents won't have to wait for care in an ER or travel to a fixed site at night. Instead, the team will come to them, assess their needs, and provide the most appropriate care for the patient. The services that they will be providing at night in a mobile unit by the paramedic and the RN with online physician support are exactly what's taking place in other communities' fixed sites. During the transition phase, as our community becomes more familiar with the mobile CEC and its services, the emergency department at the Waterford Consolidated Hospital will remain open. I also want to make it clear that this hospital is not closing, and our government is investigating with other services can be based here in this facility. As I can tell folks, no one will be charged for the use of this mobile CEC. There is still work to be done before our CEC is up and running. We need some time for the implementation of the process to unfold. I know that the Cape Breton District Health Authority and the EHS will continue to consult with the community and with officials as the Department of Health and Wellness in developing the best possible CEC for New Waterford. As we get closer to the launch date for the CEC, New Waterford families will be further engaged and more information will be provided to them at that time. As I mentioned, the development of the CEC is about securing the future of the Waterford Consolidated Hospital. As time passes, we will see even more opportunity for further development at this facility. as we work to ensure that the Waterford Consolidated Hospital continues to meet the needs of our community. As the Premier said, CECs are one commitment in better health care sooner. Government's plan for improving the health care system across Nova Scotia. Throughout the implementation of Better Care Sooner, what I have noticed is that creating positive change within the healthcare system is not easy. But with the support of the communities like ours and dedicated healthcare professionals who work here, we are surely going to do it. Thank you, and happy holidays.
Its great potential.